We have almost come to the end of the CME. I call upon Dr. Sandeep Nemani for his short talk on the topic, Evolution of Hematology Practice in Western Maharashtra. And I also request him to deliver the vote of thanks.
So, good evening all. I had sleepless nights for last 1 week. I was having goosebumps. I used to discuss with Abhijit sir every time that Vikram sir is coming, Vikram sir is coming. So all flashes in your mind, how you spent with him 4 years. And every how we used to take around 1.5 to 2 months. There are a lot of residents are sitting here to go to his room and ask for a leave. So I used to plan 2 months to ask for a leave, and then somehow I used to go to his cabin and ask for a leave. Then it was like, come again after some time. So it's like everything flashes in my mind. I could not sleep, like he's coming to visit us here. So we'll start with the evolution of hematology. I'll not take too much of your time. I'll just show you some photographs. This is how we started. This is Dr. Abhay Bhave, and I am behind him. So actually, if you can see, in year 2010, I was student in medicine at Nair Hospital, Mumbai. And he was the driving force, and he involved me in the hematological CMEs, hematological work since my MD days. And I got a lot of push from him to take hematology as a subject from my MD days itself. So I asked all the HODs that all students should come here. They should opt for some branches like rheumatology, hematology, which are very new, and they are very gratifying, like to take some new branch and develop that specialty in your region. That absolutely helps you a lot in your practice. And this is where then I joined CMC Vellore. We are parting with Sukesh sir. All of us are there from lab and from the clinic. And sir always used to emphasize on the basic things. And he used to always say that the peripheral smear examination is very important. Bone marrow will not tell you the answers, but the peripheral smear will tell you a lot of answers. So it is him. When we used to take bone marrow to him to show him, one day before we used to get the bone marrows for reporting, next day we used to show him. He used to just see the history, go to machine, spend some 10-15 minutes with the machine to play with the machine, and then he used to come here, see 30-second smear, and then he used to make his mind for a diagnosis, and bone marrow is just a formality to see. So the basics are so right, like if we can ask him to deliver a lecture sometime again on the cell counters itself. So he can just diagnose the cases on cell counter. He doesn't require to see the slides and the morphology. He can diagnose on the graphs only what the patient could be suffering from. And this is Dr. Sukesh Nair, and I'm very blessed that he was my teacher for some lab duration in my DM course. And he is Dr. Vikram Matthews, I told you. So he was our HOD when I was a student there. Now he is director of the hospital. And I am very pleased that he is around us and he has delivered a talk. Though he has discussed very complicated topic that still we are figuring out what he told, but he made it so simple that everybody understood what he wants to say. And then I came here in 2016, and then we called legends here in Miraj. So sir may not know that Maman sir, who was the, we can say, father of hematology, Indian hematology, and he visited our Siddhivinayak Ganpati Cancer Hospital. We had given them D.K. Gosavi Memorial Oration Award in year 2017, and we were very, he blessed us, and then we started our BMT program after he visited here. And then we called some Sarvals also in hematology to meet at Sangli. We had a CME in hematology, full day CME with IMA, and Dr. M.B. Agarwal had come here. And then we started with this we started our baby steps. We started our small clinic, small peripheral smear seeing laboratory. This is my daughter who is seeing the morphology as well with us. And then we came long way now. Like for 6-7 years we are practicing in Sangli and Miraj. We had treated more than 300 acute leukemia patients, more than 200 ALLs, more than 50 APMLs, more than 50 AMLs. We had done 27 bone marrow transplant, 18 allogenic transplants, 8 autologous transplants, and 1 haplotransplant. We have treated countless patients with lymphomas, myelomas, chronic leukemias, aplastic anemias, bleeding disorders that were handled by us. We are serving nearby districts of Maharashtra and Karnataka. We are doing, I am having satellite OPDs at Vijapur, so in Solapur districts, Pandharpur. Last 6-7 years I am doing, regularly I am visiting that places, seeing patients. My follow patients I see there so that they need not travel this far to see me. So once in a month I go there, I treat them there itself, so they don't come here regularly. What CMC has told us from day one is the pediatric patient should not go from the hospital without getting treatment, because the outcome of pediatric leukemias is very good compared to an elderly age group. So here also same policy we follow, and I can give whole credit to the Sri Siddhivinayak Ganapati Cancer Hospital and the director and the administration staff. We never lose a pediatric patient untreated because of the finances. So all patients of pediatric leukemias, ALLs, they get treatment somehow or the other way. We try to manage their funds and we treat them, and we don't send the patient back unless for the financial reasons. We treat all pediatric patients at cancer hospital. The hematology scenario changing very fast. When I joined, Abhijit Ganpule sir was there in Kolhapur, and I came to Miraj. Slowly the hematologists are coming. Now there is a hematologist at Satara, Karad, Solapur, Sangli, Kolhapur. Then there are a lot of districts are getting filled. So there is at least one hematologist per district, and that is the need of the time, that all the specialties has to be there in every district. And this is how the scenario is rapidly changing. But still, we have done good work, I should say, considering all the limitations we have. But still, we have 2 miles to go. As sir has already discussed, we should think of doing match unrelated donor transplant. There are some logistic issues because the air connectivity, other issues are there to get the product from outside for doing stem cell transplant. Then sir has told about CAR T cell therapy. Slowly, in a decade or so, it should come to our place also, so that we can do CAR T cell therapy in Miraj, and patient need not go to China or Singapore to get the treatment done. We have a lot of financial hurdles and self-paying patients in our region. Many of patients come from the agricultural background, no insurance policy, nothing is there. Only with some of the government support and some schemes we try to treat them. And we sometimes we feel that why I'm practicing in Sangli and Miraj, I cannot use daratumumab, I cannot use higher drugs, I cannot do CAR T cell therapy, I can't do much of the research work. But there is other way around, there is satisfaction that we have good number of patients. We are serving the poorest of the poor so that they need not go anywhere else. Sending a patient to Mumbai for a treatment is not easy. The family has to go there, the daily wages loss is there, the patient family has to sit on the footpath and take the treatment. So this all things considered, we have a satisfaction also that we are treating the poorest and poor, and still we are doing a relatively good job here. So next thing is the research work and the cooperative group formation. That is the next agenda, that there are hematologists now everywhere. We can pool the data of our own data can be there. We can just keep it ready so that in future sometime we can have publication that in the tertiary, in the third tier cities also this good work can be done. So we have taken baby steps for that. So last few years, 5-6 years, we are submitting our data of transplants to ISBMT. It is nothing but Indian Society of Blood and Marrow Transplant. So we are submitting our data there. Recently, we have collaborated with Hematology Cancer Consortium, which is brainchild of Vikram sir, where he has he has made a group of apex centers in the country, and we have recently joined them to submit our data, so that at least we will be in some research group where we can submit our data and we can this data can be utilized. And I can proudly say that Siddhivinayak Ganapati Cancer Hospital Miraj is on the India map where the transplants are done in our country. And as I told you, we are part of Haematology Cancer Consortium. Siddhivinayak Cancer Hospital proudly sits with AIMS, CMC Vellore, TMH Mumbai, and these hospitals, and Siddhivinayak Cancer Hospital is there with this group, so that we can just add on whatever few patients we have to this group, so that we also have our presence in the country. So with this, I come to vote of thanks. I thank chief guest, first of all, Vikram sir, Sukesh sir, and Abhay Bhave sir, who was virtually present with us. I also thank all the hematology and oncology colleagues, Dr. Abhijit Ganpule, Abhijit Baheti, Varun Wafna, Dr. A lot of other colleagues who have come here, Dr. Gnaneshwar Upase, Dr. Nilesh from Kolhapur, everybody had come here just to witness this opening of our center, and I am very grateful to them as well. I also thank doctors from Sangli and nearby districts who has come after me calling. Doctors have come from Pandharpur, doctors have come from Vijapur and Zat, everywhere doctors have come here. This shows that how much affection and blessings they have for us, so that we can grow and we can serve patient better. I also thank pharma companies. Since morning they are here. Intas, MQR, then Concord, all are there supporting us, taking the logistic, taking care of everyone, that everything is in place, and they are helping us in all possible ways. I also thank decoration people, catering and audiovisuals, Mr. Sharaj Shah, who has helped us in arranging in open ground with the feeling of a CME. It's just a novel way we try to do a CME with an inauguration function, and they all helped us a lot. I also thank my staff, who is there with me for last 6-7 years. None of our staff has left us. We were initially practicing in Sangli. We took all our staff from there, and they are still with us. And I thank them for all the support they give us while we in this journey. And last but not the least, my family, who is always supportive to us. My parents, my brother, everyone who takes care of my child. Like everything is set at home so that I can peacefully work whole day outside. Thank you very much.
Thank you, Dr. Sandeep. Really proud of your journey and all the best for your future endeavors. With this, we have come to the end of today's program. Thanks for your valuable presence and patient listening. Everyone is requested to proceed towards the dinner, which is arranged in the adjacent area. Thank you so much. Thank you for the lovely evening.
I also thank MOC, Mrs. Udgaonkar. She has wonderfully conducted the MOC of like we can say medical session. Though from a non-medical background, the pronunciations of all the medical terms were absolutely fine. So I thank her for doing this MOC for us. Thank you, madam.
Thank you, sir.